Doctor, when we take the diabetic parents,
Yeah.
what is the chance of the sibling to have to get?
It's something like this. Some say, doctor, I'm just 30, I've got diabetes, and when we take a history, they say my mother is a diabetic, but she got it when she was 60. Well, this is the nature of this disease. What we find, the trend, especially in type 2 diabetes, if the parent gets it at the age of 50, the child will get it at the age of 30, or it is some 10, 15 or 20 years earlier. Now this person has to be careful because his child may get it even earlier. Now this is the nature of this is the trend which we find, especially in type 2 diabetes. So if both the parents are diabetic, especially the elder sibling stands a very good chance, at least 80 to 90% chance, if he is not careful. So they have to be screened. So this is one of the guidelines. This is one of the areas. If both the parents are diabetic, the children needs to be screened, especially if they have risk factors like parents' diabetes or obesity or their irregular lifestyle and food habits.
Okay, Doctor, one more question here. What about this intake of sugar content? In the sense excess sugar content in a normal person. What is the chance of them to get a diabetes?
See, it's very unlikely. If a normal person has got a normal sugar intake, that's okay. But then it's primarily because you have it's mainly associated with your sedentary lifestyle, your intake of excess calories. A normal individual, a male needs about 2000 odd calories a day. Who doesn't do who's not a manual laborer? I mean to say a person who works normally in his house. And a lady needs to about 1800 or maybe about 2000 calories.
Maybe to say an office person or
that's it.
Fine, yeah.
So now what happens here is many times you have in between snacks. You take a samosa. A samosa will cost you 300 calories. So you won't end with one samosa. You will end with couple of 2 or 3 samosas. This is just your snack. You are not skipping your meal or anything. You take a parota which is about 320 calories. One single parota will cost you 320 calories. So you don't stop with 320 calories. One parota. You have 2 or 3. This is only for a meal. You've got other meals to go on. So this intake, this excess of carb intake is converted to sugars, and this is where we mess up with the diet and the lack of exercise. So in a diabetic patient, the ADA guidelines just says you need about 150 minutes of brisk walking a day, which gives you a good control of your sugars. That makes it of an average of 20 to 25 minutes a day, which normally many people don't do. So it's basically your lifestyle, your eating of excess calories of food, the junk food. This is what causes the risk, increases the risk for developing diabetes.
So Doctor, you've explained very well about the diabetes, its management and complication. Thank you so much.
Thank you very much.
So guys, if you have any doubts, please write to us. Our email ID is youthdiaryrosebowl@gmail.com. So see you next week.